Good afternoon, good evening, good morning, wherever you are in the world. Hi, this is Dr. Muska. I'm coming in live for your exam preparation. That is for your FMG exam. That's going to start as soon as possible, maybe on the 15th of this month, right? Or 16th, I suppose. So let's go through the important questions, the PYQs, the previous year questions that have completed. I'll be completing pharmacology, I'll be completing biochemistry as well as medicine. Okay, we'll be trying to cover majorly about around 40 questions each, the most highly asked questions. I'll give you the explanations as well along with it. Let's go with the questions and let's understand each and every question in detail, right? So 40 questions, I'll try to complete it within 1.5 hours. Let's start. Okay, right now. It's a live call. If you have anything, you can. It's a live, what do you say, class as well. So if you have any doubts, I'll be looking into the chat as well. I'll try to clear off your doubts. Okay. First, let me clear the class and then we'll go into doubts. Now, starting the first question that we have. The first question of FMG pharmacology that we have, PYQ, is a question that says, which agent is not used in bacterial vaginosis? Bacterial vaginosis is a condition that is commonly known in a gynecs, the OP department. People do come with a case of bacterial vaginosis. But what exactly is it? Let us look. See, remember, we have to eliminate all the options. Okay, right? Let's try to find out what is not used. Remember, used, not used. Be careful about the. This is used, but just don't go with the first option, second option. Look at all the options clearly before taking the right option. Please look at the options clearly. Okay, right. So the first one what we have is first you should know what is bacterial vaginosis. What is bacterial vaginosis? It's a condition. What is it a condition? Actually infection है? No. It's a slight change in the pH that leads to problems. ठीक So remember, write this question down if you want. Bacterial vaginosis, very important. It is not an actual true infection. ठीक It's called as dysbiosis. What is it called? Dysbiosis means what? A different kind of changes because of the pH of the area. Okay, vaginal region. What exactly happens there? Normal vaginal flora that we have is your lactobacilli, also called as dodeline bacilli, right? These dodeline bacilli are very important to maintain the pH. Make sure that things are in the right order. Maintaining pH by dodeline bacilli. When the number of lactobacilli come down, the chances, just because the pH has gone down, the chances, like opportunistic chance for other bacteria to start growing, because the area becomes fertile for them to start growing. Okay, so what happens? Anaerobic bacteria start growing. Anaerobic bacteria. Now remember that this we are going to count as what? Anaerobic infection. Now keep in mind, it's an anaerobic infection treatment. Anaerobic. Okay, anaerobic. Now when it comes to anaerobic, when we say, what does it mean? We need a drug that should act in anaerobic bacteria as well. Remember that very well. Okay, anaerobic bacteria, it should work properly. So which of these drugs are majorly used in such conditions? Okay, we know these drugs: metronidazole, tinidazole. Okay, we have erythromycin and clindamycin. What do you think is the answer here? Let us eliminate. Let us eliminate things. Okay, what exactly? Can we use metronidazole? Do we use it in conditions of the GIT where anaerobic bacteria are there? Yes, it's a drug of choice. It is a drug of choice for bacterial vaginosis is metronidazole only. It will kill bacteria. How exactly? It breaks the strands of the DNA. Okay? That's how it does. It is used as a vaginal gel. In that area, a gel application is done. Metronidazole, tinidazole, same class. So will it act? Of course, it will act. Yes, it has better GI tolerance, therefore tinidazole can also be used. Clindamycin. Clindamycin also, clindamycin is a lincosamide type of drug. Clindamycin also, yes, clindamycin also has a anaerobic effect. But whereas azithromycin, roxithromycin, these are which kind of drugs? They are macrolide drugs. Macrolide drugs. Now, what does a macrolide drug do? Macrolide drug does not act against anaerobic infection. Can we give erythromycin in this case just because it does not act? No. Why do you want to do that? It's a macrolide antibiotic. Of course, it has a problem. It's not as bad as aminoglycosides, of course. But tell me, it's going to be a drug that is used for aerobic infections. Now, this is a anaerobic infection, clearly. So, eliminate the three. The drug of choice actually is metronidazole. Metrogel ointment can be used. Tinidazole also can be used. Better absorption, better GI tolerance, yes. ठीक है, clindamycin can be used, lincosamide, but not erythromycin. Remember, erythromycin is a macrolide antibiotic. ठीक है, remember this is a macrolide antibiotic. Remember that. ठीक है, it has very poor anaerobic spectrum action. Okay, very poor anaerobic spectrum action. It is used for aerobic. So does it remove the drug? Does it remove the infection? No. ठीक है, remember that. So it does not be used. It's not used in these conditions particularly. For your infection like this, it is not used. Remember that. Okay. Now, erythromycin is the answer over here just because it does not affect against what? Tell me. It does not affect against anaerobic infections. Right? Chalo. Done with that one. Next, what we have? Second question. Very important question. Very interesting question as well. Preferred antidote for methanol poisoning. Have you heard methanol poisoning? Yes. Ethanol poisoning तो वो of course keeps on going on, जाके पी के परेशान हो जाते हैं, अलग बात है. ठीक है? And can you hear me? Let me see how much is the volume. Hello? Can you hear me clearly? Okay, right. So we'll go for preferred antidote. Antidote का मतलब क्या होता है? What exactly? They should exactly do the opposite action. It should completely block the action. Methanol poisoning में what can we give? Let us break down the question. Methanol poisoning is very damaging. Why exactly is it damaging? Sir, ethanol is, sir, ethanol. What is the problem? See, when ethanol comes in your body, what happens? Ethanol is a alcohol. It breaks down. Ethyl alcohol, right? It will break down. It will form what? At the end, we form something called as acetic acid. Ethanoic acid is acetic acid only. And acetaldehyde. Acetaldehyde as well. This is damaging, of course. It is damaging. Yes. But not as damaging as what? Tell me. When methanol is taken, the same thing undergoes a conversion. How exactly is that conversion happening? Remember, very, very important. Once methanol comes inside your body, what happens? There's a very important enzyme called as alcohol dehydrogenase. Alcohol dehydrogenase. Now, alcohol, methanol is alcohol, na? OL आ रहा है यहाँ पे. Methanol is a alcohol. The dehydrogenase will convert methanol into methanol and methanol into what? Methanol means what? Formaldehyde. And at the end, methanoic acid is formic acid. So remember that methanol becomes formaldehyde becomes what? Formaldehyde, which becomes formic acid. Formic acid. Now, formic acid is very, very, very bad. Formic acid is very bad. Why? Formic acid would lead something called as acidosis. Formic acid will lead to metabolic acidosis. Very, very bad condition. We don't want that. It will lead to something called as what? It also leads to optic nerve damage. You'll have eye problem, optic nerve damage, right? Blindness will happen. So it is, of course, you have to treat it. So first thing that comes to mind, they're trying to trap you in this question. When you learn this question, they tell you that methanol, take ethanol in place of methanol. Take ethanol in place of methanol, what happens? Of course, he drank methanol, make him drink ethanol. What will that do? What will that do? It will literally use up the enzyme. Which enzyme? The which one? Tell me. What is it? Alcohol dehydrogenase. It will use up. Therefore, no alcohol dehydrogenase to convert methanol to formic acid. Right? Formaldehyde, then formic acid won't convert बोलकर. ठीक है? Remember that. Now, when you use up the enzyme, that is there, of course. But is there a better option? Look at all the options. Do not rush to click ethyl alcohol. It was a earlier treatment. It was. I will not deny that. It's not a treatment right now. Why? In case you don't have the actual drug, you have no other option. Give him some ethyl alcohol, of course. ठीक है? But if he has the drug flumazenil, very very important, flumazenil, flumanazil नहीं है, flumazenil है. Now, is it right? No. Flumazenil is for benzodiazepine. He has naloxone. Is it right? No. That is for what? Naloxone is for opioids. That is morphine. So flumazenil is wrong. Naloxone is wrong. Ethyl alcohol was right, but these days not used. Fomepizole. Is fomepizole the answer? Yes. Flumazenil is for benzodiazepine. We'll get the question later on, don't worry. Next, naloxone, majorly for what? 100% naloxone, naltrexone, etc. and all these are for morphine poisoning. Morphine, we'll go to that question as well. Last one that we have is ethyl alcohol. Of course, we know it was an earlier treatment, but not these days. Remember that, write it down. Flumazenil for benzodiazepine. No involvement in alcohol, nothing to do with alcohol, does not affect the alcohol dehydrogenase enzyme only. So leave it. Next one, what do we have? Next one is naloxone. Naloxone was what? Opioid antagonist. Used for what? Naloxone is for morphine poisoning. Opioid like morphine. Not for methanol, not for alcohol. Ethyl alcohol, yes. Older treatment. Competes for ADH. That is what? Alcohol dehydrogenase. But there's a better treatment. Less predictable, of course. More side effects. Okay? Now replaced by a better drug called as fomepizole. Now what does fomepizole actually do? What does fomepizole do? Okay? Look at this. Fomepizole is a competitive inhibitor of alcohol dehydrogenase. It's a competitive. मतलब क्या है? You have one seat, you have two people fighting for it. It's called as competition. Okay? What is non-competitive? This makes sure that the other one does not sit on the seat. That is non-competitive. मतलब he will not come and sit on the seat. He will make sure that someone else also can't sit on that seat. Understood? That concept is important. Right? Okay. Now, okay. Next, what we have? Just write it down over there. It's a competitive. It is a competitive inhibitor of alcohol dehydrogenase. Understood? Yes. Therefore, it blocks the first step itself. Methanol does not convert to formaldehyde only. So no formaldehyde, no formic acid. No formic acid, no damage. Very very important. Okay. So what happens to methanol, sir? It leaves the body unchanged. Best and safest antidote for methanol poisoning. Remember that. So we're done with first question. That was bacterial vaginosis. What do we not use? Drugs which act on anaerobic bacteria we wanted, right? Erythromycin does not do that. Macrolide antibiotic do not do that. Next, what we have? We have the next one, methanol poisoning. Very important question. Remember that very well. Okay. Next question that we have. What is the next question? The next question is the treatment of CMV retinitis. What is CMV retinitis? Any idea? CMV retinitis is cytomegalovirus retinitis. It is inflammation of the retina, of course. Okay, because of the virus. Now, of course, it's a viral infection. What do you go for? Antiviral. Got it? Viral infection, antiviral. Let us see. Out of all these four, how many of these are viral infection, antiviral drugs? Acyclovir, yes. Ganciclovir, yes. Tenofovir, yes. Where is there? Virus. What is cotrimoxazole? What is cotrimoxazole? Please tell me. It's not cotrimoxazole, right? Cotrimoxazole, cotrimoxazole बोल सकते हैं, but don't confuse it with clotrimazole. Clotrimazole is going to be a antifungal. Okay, so cotrimoxazole that we have is going to be a combination of trimethoprim and sulfamethoxazole. That is something called a sequential blockade. Okay, that question they might ask, which of the following drugs has a sequential blockade? Okay, right. Let's come back to this. So in these CMV retinitis, how exactly do we know? Acyclovir, where do we use? Ganciclovir, tenofovir. They are different classes, different kind of mechanism of action. Let us go for it. Now the first thing that we have is the answer kya hai? We'll break down each and every answer. Okay. First one, acyclovir. Acyclovir is very active against herpes simplex and varicella zoster. Okay. Herpes simplex and varicella zoster. Yaad rakho. Very, very important. Not against CMV, because CMV does not have what? Thymidine kinase, where this works. Remember that we have to use a drug that inhibits thymidine kinase. It does not act against CMV, lacks thymidine kinase, so acyclovir does not work here. Acyclovir requires thymidine kinase. It does not have that. Next, cotrimoxazole. It's not at all a antiviral drug. It's used for what? Tell me. Pneumonia. It's not against cytomegalovirus. Tenofovir is an antiviral drug, but it's antiretroviral drug. Retroviral in the sense HIV, not CMV. Then what do we have here? Ganciclovir. Now ganciclovir, why exactly? That is going to ganciclovir, of course. Okay. In this case, majorly if you have CMV retinitis, what happens? What do we have here? Ganciclovir is used where there's a guanosine analog. It's a guanosine analog. What do we do? It will inhibit CMV DNA polymerase. Now, so look, DNA polymerase. What does that enzyme do? In biochemistry, of course, you know. DNA polymerase क्या कर रहा है? What does it do? The enzyme is polymerase. मतलब क्या है? It will form polymers. DNA means forming DNA, long strands. If I stop that, will it further grow? No. Therefore, what happens? It will inhibit that. Given IV for induction, and then we can give oral valganciclovir for maintenance of this particular thing, for reduction of the viral load. So remember the presence of what? Sorry, absence of thymidine kinase. Cytomegalovirus does not have thymidine kinase, so acyclovir does not work, but I would say ganciclovir works. Ganciclovir मतलब क्या हो रहा है यहाँ पे? We can give a oral valganciclovir also. Okay, right? Remember that. It's going to affect which area? DNA polymerase of what? CMV. It does not allow its growth. Simple as that. Okay, that is very, very important. So answer is ganciclovir. Next, what we have? We have a very nice one. That is going to be your question for just now. We had to talk about this. What was this? Antidote for benzodiazepine poisoning. Benzodiazepines क्या है? BZPs. What are BZPs? Tell me. क्या था? Diazepam, lorazepam, right? These drugs are benzodiazepines. ठीक है? If excessively, normally what happens now, these benzodiazepines have a nice therapeutic window, not very bad. Of course, detail में क्या तो अलग बात है, but diazepam ज़्यादा dose लिया तो भी it's okay, the body can handle. Not like barbiturates. Barbiturates are very bad. Benzodiazepines, you can be, it's fine. Assume that you have taken benzodiazepine overdose. What is a particular drug that is used against it? Now let us break down each and every answer. Fomepizole, just now we read. Fomepizole is for methanol poisoning. Naloxone is for what? Opioid poisoning like morphine. Flumazenil and folinic acid. Two things are there now. We talked about flumazenil, don't worry about it. But flumazenil is exactly what is going to sit in the place of, it's a competitive inhibitor for what? Benzodiazepine. Look at this. Flumazenil is the answer here. Why? It's a competitive antagonist that comes and sits at the GABA A site. What is GABA A site? Where benzodiazepine comes and sits. Okay? So flumazenil is going to be a what? Benzodiazepine blocker kind of thing. Okay? It blocks the site. Competitive inhibitor. Like fomepizole, it's a competitive inhibitor. Rapidly reverses the sedation. Rapidly reverses the what? CNS depression as well. Okay, put your mind to it. There are only 40 questions. Okay, of course, it's getting recorded. You can just review it once. ठीक है, वो keep on listening to this. What happens? एक दिमाग में बैठ जाता. ठीक है, try your best to do that. ठीक है, I'm trying to do these questions as soon as possible. Let's see. ठीक है. Now remember what can we know? Fomepizole we didn't give, naloxone we didn't give. But folinic acid क्या है? Folinic acid and flumazenil and fomepizole. Fa. क्या है भाई fa? The fa is what? Fomi for methanol, flumazenil for benzodiazepine, and folinic acid for methotrexate toxicity. Methotrexate. What is methotrexate? MTX, not MDH. MTX. क्या है वो? MTX. It is for what? Treatment of cancers. Anti-cancer drug. ठीक है? So that is folinic acid. Understood? So the answer here is what? Flumazenil. What do you should remember? Competitive antagonist at the site. Which site? Gamma A site. ठीक है? So overdose. Answer is flumazenil. ठीक है? Next. What can we go for? What can we go for? Come on. Next question. Of course, see the answer is flumazenil. Next one we have is something called as cisplatin. Cisplatin. What is cisplatin? Any idea what is cisplatin? Tell me. Cisplatin. Platin नाम है ना? Platin मतलब क्या होता? Platinum compound. Platin means platinum compound. Okay. Now platinum compound मतलब क्या हो रहा है यहाँ पे? It contains platinum. Is it toxic? Yes, it can be toxic of course. ठीक है? It can be toxic of course. ठीक है? It is used in which conditions? Of course, used cisplatin for cancer. It's an anti-cancer drug. What can we use it for? We can use it for a very important cervical cancer, ovarian cancer, lung cancer. Cervical, ovarian near the genital region. Cervical near the cervical region, ovarian, and then lung cancer as well. Remember that. It is very effective. Yes, it is very effective, but it is very toxic as well. Platinum compounds your body can't handle. ठीक है? Your body can't handle platinum compounds. So be very careful about it. Toxicity, important most toxicity क्या है? What exactly is it? The major toxicity is going to be the damage to the kidney. Kidney nephrotoxicity is very damaging. ठीक है? Remember that. Very important. It's going to be causing very important thing called as nephrotoxicity, which is majorly, of course, what? Tell me. Renal tubular damage. Renal tubular damage. ठीक है? What does that do? If we have damage to renal tubules, what are they do? What are they there for? Why are the renal tubules there? To have a proper glomerular filtration rate. If you don't have proper filtration rate, do you properly produce urine? No. Are you able to remove the stuff? No. So what happens? What of the tests of these people go wrong? What tests will show very high levels? Urea and creat. The kidney is going into problem. He will have kidney failure. He will go on lifelong dialysis. Okay, remember that dialysis is a problem then for them. Okay, they could have avoided that by taking some other medication. So remember, this reduces the GFR. Yes, it reduces the GFR. Along with that, it causes electrolyte disturbances, majorly magnesium ones. Okay, right? That's very important. Remember that most feared toxicity in platinum compound like cisplatin or carboplatin also is one drug. Be careful. Okay? The other drugs are there. Let us see. GI toxicity is very commonly seen where? Okay? It's seen with most of the drugs. So it's not a particular toxicity. GI toxicity everywhere. Tablet खाए GI toxicity होती. Neuro is seen with crystin ones. Vincristine is there, no? Vincristine, vinblastin will cause neuro. So remember that this is for vincristine, vinblastin. Vinca alkaloids, these are Vinca alkaloids. Pulmonary fibrosis are what? Pulmonary fibrosis seen very importantly in bleomycin. In bleomycin. I don't know how to increase the volume here. I'm going to put it exactly within this area. I'll try my best. Wait. Are you able to hear my voice now clearly? Should I keep it like this and talk? Give me a yes or a no here. I'm waiting for the answer. Let me just take this out from here and hold it in my hand so that it becomes easy. 1 second. Now are you able to hear, all of you? Yes? Okay. So I'll go like this only. Okay. Now, so bleomycin, remember blow in the sense, right? Pulmonary, bleo, pulmonary fibrosis. याद रखने के लिए, for important for remembering it. ठीक है? So remember, nephrotoxicity is the major answer for which one? Platinum compound like cisplatin and carboplatin. Now, what is the mechanism of action of dicumarol? Do you know what is dicumarol? Anyone? Dicumarol is going to be what? It's going to be a very important drug. That is going to be what? Tell me. It's a oral. It's a oral anticoagulant. Oral anticoagulant. So how does it work? How does it work? Very important. See, the major answer over here, of course, is going to be the action on. Let us see what are given options. We'll see. Then we'll go into it. A option says inhibits plasminogen activation. Okay. Inhibits vitamin K epoxide reductase. Okay. Chelates calcium. No. Increases AT3, antithrombin 3. No. The major action over here is going to be your inhibits what? Vitamin K epoxide reductase. What does this do? What does vitamin K epoxide reductase do? It is very, very important for decreasing the activation of factors like 2, 7, 7 not 8, 2, 7, 9 and 10. Okay? So major decrease in the activation of these. That's why the answer is inhibition of vitamin K epoxide reductase. That action is seen by oral anticoagulant like dicumarol or warfarin. Okay? In this case, remember that. So remember what are the factors names? Any idea? Factor names, please. Factor number 2 was prothrombin. Factor number 7, factor number 9 and factor number 10. Also protein CNS also. Okay? Now, how exactly does it work? Tell me. How is it working? Come on. It's very simple. This enzyme is inhibited. Simple. Dicumarol comes, inhibits the enzyme vitamin K epoxide. Therefore, no generation of these clotting factors. When you don't have clotting factors, do you have coagulation? No. Simple as that. That's why it works. Okay? Got my point? Yes? Okay. Why are the other options wrong? Is one more question. Why are the other options wrong? The first one, option A क्या है बोलो? Inhibits plasminogen activation. This inhibits conversion of plasminogen to plasmin. Okay. So उससे क्या होता? That's fibrinolysis, no? Fibrinolysis. I not coagulation की बात नहीं हो रही यहाँ पे. ठीक है? It is related to something called as streptokinase action. ठीक है? That's how it is going to be. Not warfarin. Streptokinase का action is this one. Next क्या है? Option C. Chelation of calcium. Calcium where? EDTA. Not by warfarin. It is done by EDTA. ठीक है? EDTA क्या है? Ethylene diamide tetraacetic acid. Remember that. And last is AT3. What is that? Increases antithrombin 3. What is that? Heparin, not warfarin. Warfarin works on vitamin K epoxide reductase. Remember that. Okay? Right. Remember that very well. That's going to be the 6th question. Now coming to the 7th question. Let us go to the 7th question. So the answer was vitamin K epoxide. 7th question क्या है? Have you ever heard the name of this drug? This drug कहाँ देखे हम लोग? पहले वो समझो. Because it's not mentioned. This drug is used in बोल के. First thing, bedaquiline. Have you ever heard the name bedaquiline? It's a new drug. It's a new drug for treatment of what? It's a new drug for the treatment of tuberculosis. Very, very important. इतने सालों से, in so many years, we have been using what? We have been using rifampicin, isoniazid, etc., etc. But now comes a new drug. ठीक है? Either will kill the bacteria or reduce the or is a bacteriostatic bactericidal action. ये action कैसा कर रहा है? Let's see. ठीक है? Out of these 4, what is the mechanism of action of bedaquiline? Now remember, bedaquiline is what? It's a new anti-TB drug. ठीक है? That is used not in normal TB, it's used in MDR TB or XDR TB. What is MDR and XDR? Multi-drug resistant TB. If you don't have any effect from the other normal drugs that were there, that is when we start using bedaquiline. Okay, remember that it acts on the energy production of the bacteria. That is your MTB. What is MTB? Mycobacterium tuberculosis. Understood? So how do we understand this mechanism of action? Simple. Mycobacteria, of course, require ATP to survive. You need khana. You need something to eat, right? To survive. They also require something to survive. Yes. So what happens here? ATP produced by ATP synthase, of course. Now they will come and block the proton pump of ATP synthase. When there is no ATP synthase, can he produce ATP? No. When they cannot produce ATP, where does the energy for that MTP come then? It won't come. Therefore, a problem. Okay? Be very careful. Okay? Leads to energy starvation. Therefore, leads to the death of the bacteria. Okay? Right. Now, next क्या है उसके बाद? Remember, they ask this question. Newer drug. They ask it. Very commonly asked drug है. ठीक है? Remember that very well. Other options wrong क्यों है? First, inhibit ATP synthesis is the right answer. Okay, fine. Why is RNA polymerase wrong? Why is adenylyl transferase wrong? Let's see. When I talk about RNA polymerase, the drug which affects this RNA polymerase is your rifampicin. Rifampicin affects RNA polymerase. Remember that. Okay? Whereas the next one is going to be what? Tell me. Arabinosyl transferase is going to be a problem with what? Ethambutol action. Ethambutol action is going to be the one causing ethambutol is going to be the one that is inhibiting your arabinosyl transferase. Last one is catalase peroxidase. Catalase peroxidase by what? Isoniazide. So it is mentioning all the remaining three also, rifampicin, ethambutol and isoniazide also. It also mentioned bedaquiline, new one. So remember, bedaquiline is going to be a energy depleting kind of a drug action going to be seen. Okay, energy depleting action agar hai, so that is the problem that happens. Okay, right, very important. ATP synthase inhibitor. Adverse effect kya hai? Under idea, if they ask you, adverse effect of particularly your bedaquiline is going to be a QT prolongation. QT, remember the say waves, QT prolongation is going to be seen. Okay, remember that. Energy block is always bedaquiline. Okay, right? So that was your 7th question. Next what we have is your 8th question. 8th question kya hai bolo? Okay, you don't have the PDF now. 1 second, wait. 8th question is going to be iron poisoning question. What is the iron poisoning? See, answer is ATP synthase inhibition. Okay. Now, antidote for iron poisoning. Iron poisoning hoti kab hai? Why exactly? Where do we have iron poisoning happen in a patient? Either he has taken iron too much. Through what? Majorly blood transfusion. ठीक है? Too much iron poisoning might happen. So what happens? Tell me. Oh, Zada sir, he ate a lot of iron. Yes, tablets Zada kha liye. Too much of this and that might happen, but majorly it happens because of blood transfusions. So what do we do? What can we do? Let's see. D-penicillamine, desferoxamine, EDTA, and British anti-leucite. BAL is British anti-leucite. What can we use? The whole thing is that we want to reduce the damage by the iron causing. So what do we have? Naam mein hai na? What is iron? Iron also called as ferrous, ferritin, ferry बोल के आता ना? So anywhere ferry around this in drug? What is it? Desferoxamine. Deferoxamine नहीं है, desferoxamine है. ठीक है? Is going to be used where commonly in children who have accidentally ingested some kind of iron tablet ज़्यादा ले लिए. What do they have? They will have symptoms like vomiting, abdominal pain, etc., diarrhea and all. ठीक है? Remember that. Now, why is iron dangerous here? It is a free radical forming thing. So we don't want to have that in the body, causing more and more damage. Okay, it might lead to acidosis as well. It might lead to GI necrosis. It can lead to liver failure. Too much iron is not required. We don't want anything in a high amount. Glucose भी ज़्यादा नहीं चाहिए आपको कुछ भी चीज़. Body always has a limit. You have to stay within the limit. ठीक है? You always have a range. What is the pH of the blood? 7.35 to 7.45. इसके नीचे गया तो acidosis, उसके ऊपर गया तो it becomes alkalosis. Remember that. Okay. Next, how exactly does desferoxamine work? ठीक है. Desferoxamine actually is a specific iron chelator. Chelator मत बोलो, it is chelator. What is chelation? What exactly is chelation, man? What exactly is chelation? Chelation मतलब कि he comes in, takes, चलो साथ में हाथ मान के चलो, it makes it a non-toxic compound and leaves the body. Simple as that. Comes in, binds to the free iron molecules, forms something called as ferroxamine, and then leaves. And in this way, actually, the urine becomes kind of pink and red in color. Don't worry, it's not blood. It is a compound. ठीक है? Remember that. D-pencilamine कहाँ use करते हैं आप? Pencilamine is for what? Copper. Copper. ठीक है? Remember that. Let me write it down. The answer over here is desferoxamine. This is for copper. When copper is high, it forms two things are high like this. See what is it? Wilson's. Remember that Wilson's disease is high copper. What is low copper called? Low copper called Menkes. I'm just reminding you. नाम क्या है? This is not there over here. I'm just telling you. Too high like this, W बना उसको becomes Wilson's disease. Too low is what? Menkes disease. Very good. Very good. Shamiksha. Very nice. Next क्या है? We have EDTA. EDTA is used for what? Lead poisoning. Is lead poisoning common? Yes, children will have in old days home आपके दादा का उनका paints को जाके चाट लेते बैठे. Lead poisoning. Also called as, what is the other name of lead poisoning? The actual name of lead poisoning, please tell. Anyone? Plumbism. Plumbism. ठीक है? Remember that. ठीक है? Very very important. Next क्या है? What we have? We have British anti-leucite. It is used for arsenic and mercury. Okay? Remember that. EDTA was for what? EDTA was for lead poisoning, and British anti-leucite for arsenic and mercury. Arsenic and mercury. Very very important. Okay? That's how it is. So remember desferoxamine over here. Next question that we have is going to be, see, answer was desferoxamine. Next what we have, ninth question, is going to be your, what is the drug of choice in hyperthyroidism in third trimester? ठीक है? Pregnant lady, 2 trimesters per, what is trimester? ठीक है? How many months pregnancy? 9 months. First 3 months first trimester, second 3 months second trimester, third trimester third trimester. Simple. Now third trimester में, if there is hyperthyroidism, yes, what exactly are you going to go for? What exactly are you going to give this pregnant female? Pregnant. Remember that. So remember that in pregnancy you have to be very careful. Why should you be careful? Because whatever the female who is pregnant will take medications, it will affect the fetus or the baby. Why? It passes from the maternal circulation to the fetal circulation. And very very important. Now hyperthyroidism pregnancy is very dangerous. Why? It might lead to maternal hypotension that will affect the baby. It might lead to something called as preterm labor. Preterm labor in the sense baby will come out fast. Baby will be preterm baby. Will the baby grow fast? No. The baby will have something called as failure to thrive, unable to catch up growth. Yeah. Fetal thyrotoxicosis might happen. Damage might happen. Okay. Drug should be very effective and least teratogenic for that fetus. It should not cause too much damage. Remember that. Why are we preferring a drug? Which one is that? Carbimazole is there, PTU is propyl thiouracil, sodium iodide and radioactive iodide. Let us look at the first one. Carbimazole. Yes. Antithyroid drug? Of course. Methimazole, carbimazole, yes. But it is known to cause damage like हमने called as aplasia cutis. Along with that, choanal atresia has been noticed and researched on. So remember that we do not go for this, in especially in the first trimester when nothing is formed properly. So we don't want to take that risk. Sodium iodide, fetal goiter will happen. Direct damage is there. We don't want that. Hypothyroidism have occurring damage directly occurring. We don't want that. Radioactive iodine. Do not ever give anything radioactive. Why? It might damage the fetal thyroid. It will never form only. Absolutely contraindicated is radioactive things. Okay. What is the option now? Propyl thiouracil. Propyl thiouracil is very very helpful. Okay. Propyl thiouracil is helpful because it inhibits an enzyme called as thyroid peroxidase. Thyroid peroxidase क्या करता है? Simple. It will not allow the iodination. मतलब iodine नहीं बना तो what happens? Do you form your T3T4? No. ठीक है, decreases the coupling. Therefore, the peripheral conversion of T4 to T3 and all will be inhibited. Therefore, the damage due to too much level of hyperthyroidism is not there. Okay. So what is the answer here? PTU. Propyl thiouracil. Get that point. Okay. Right. So that was your ninth question. Answer is propyl thiouracil. Okay. Right. Propyl thiouracil. Next one, what we have? 10th question. 10th question is going to be an SSRI causing discontinuation syndrome. Let us break down this question. What is SSRI first thing? And what are the drugs that are there in this? Let us see that first. It will help you very easily. Okay, the drug actually will help you very easily. I don't know why this question has only one drug, but we'll see. Now remember SSRI causing discontinuation syndrome. SSRI is what? Selective serotonin reuptake inhibitor. Simple. Selective serotonin reuptake inhibitor. SSRI. Now, name of the drugs. SSRI's name क्या है? What exactly do we have as name of the drug? Tell me. We have very simple. Citalopram, escitalopram, fluoxetine, fluoxamine, paroxetine. पांच है. ठीक है. Citalopram, escitalopram, fluoxetine, paroxetine. Other all are not SSRIs given in this. Look at that. Lithium is not an SSRI. It's an antimanic drug. Okay? Very dangerous drug. Very low therapeutic index. Narrow therapeutic index. Be very careful. So it will not cause discontinuation syndrome. Fluoxetine, yes, I just not told of fluoxetine, paroxetine, citalopram. Yes. So you have one at least on this case. Next is buspirone and haloperidol. Buspirone is an anxiolytic. Okay? And haloperidol is not used as a SSRI. It does not have the effects of SSRI. Okay? The answer here by default is fluoxetine only. Okay? Remember that. Now, remember this. Why does a patient take SSRI? SSRI ले रहे क्यों? Why? The patient will have insomnia, restlessness, anxiety. Okay? So you're not allowing the reuptake. You want that levels to rise in your brain of serotonin. Is serotonin good for you? Yes. Okay? Serotonin is a good thing for you. You want it to stay there at the site of action. If you keep on reuptake karte gaye, what happens? It leaves that area, no? So block that. Stay there for longer time. Make him feel happy. Make him nicely sleep. So insomnia के against काम करता, anxiety के against काम करता, ठीक है? Headache के against काम करता. It works. ठीक है? Remember that. Symptoms started after using antidepressant. So very good. SSRI adverse effects are not. These are SSRI adverse effects, not depression problems. Now, why is the drug fluoxetine right over here? Because it's SSRI. That's a simple answer. It should be a 2-second answer if they have given this. Okay? Remember that. So, what do we have? Answer because it's SSRI. Second thing, of course, it increases serotonin where? Reuptake. If it blocks the reuptake in the CNS, where does it increase the level of serotonin? CNS. Also seen as a side effect is GI tract also. Therefore, it can cause anxiety, insomnia, and GI upset. It can happen. Okay. Next, क्या है उसके बाद? Special properties is what that. The thing is, it is the longest half-life among the SSRIs is fluoxetine only. Longest half-life. तो longer time के वास्ते रहेगा. It takes longer time to become half, then break down, then break down, then break down. Takes time. Understood? Yes? Right. So that is your thing. Remember that SSRIs adverse effects are what majorly? Anxiety can happen. Along with that, GI upset can happen because it affects these two areas, CNS and gastrointestinal tract. Understood? Okay. Very simple answer. The name is there. Fluoxetine बोल के है ना, answer वही है actually. Don't waste your too much time on that. Got it? Now the 11th question, very commonly asked question. What is it? Drug of choice for organophosphate poisoning. What is organophosphate poisoning? When I say organophosphate poisoning, which system comes to your mind? Cholinergic, anticholinergic, sympathetic, parasympathetic, which one? Of course, parasympathetic also called cholinergic, that is sympathetic adrenergic. ठीक है. So what I'm talking about is right now organophosphates are cholinergic activators. ठीक है. Irreversible type. Reversible type are what? Diet-acting drugs like pilocarpine and all. ठीक है. Or methacholine, bethanechol. Or also anticholinesterase drug like physostigmine, etc. But in this case, we are talking about organophosphate poisoning that can be irreversible in nature. Commonly seen in patients who are under a lot of stress. They go and take this ingest, some kind of a OP poison. OP poison in the sense pesticide. Pesticide. Very, very important. Pesticide पी लिया यार बेचारा. क्या करा? परेशानी है, पैसे नहीं मिल रहे. Modi has given 15. No, no, sorry, not given. No, okay, not given. Right? These things are there. So all of these parishani and lot of rain, the whole crop has wasted, nothing is selling, government is buying it, value roll it. They will take a big drastic step. Please stay away from these things. So this drastic step, of course, of organophosphate poisoning that happens can happen, of course, suicidal, can happen accidental also. ठीक है, by children. ठीक है. Children's favorite thing is what? Lick stuff. ठीक है. Drink stuff, lick stuff, take something, put in mouth and see how is it tasting. बोल के. So be very careful. So drug of choice for organophosphate poisoning, what do we have? We have cholinergic effects. What are the cholinergic effects? Cholinergic effects are, remember, dumbbells. ठीक है. Cholinergic effects are dumbbells और sludge बोल के भी है, but remember dumbbells. Dumbbells में क्या हो रहा? D for diarrhea, U for urination, M for meiosis, pinpoint pupils, meiosis, not mydriasis, meiosis. ठीक है. Then M, B for bradycardia, remember, and then B for bronchoconstriction, not dilation. Constriction. D U M B B हो गया. L हो गया. L sorry E हो गया. Dumbbells ना E. MSS causes MSS. L lacrimation. Then salivation and sweating. Dumbbells. Then what is anticholinergic? Opposite of dumbbells. What is the opposite of dumbbells? D is the opposite. Diarrhea का opposite constipation. Urination का opposite urinary retention. ठीक है. उसका opposite. Then M का opposite meiosis का mydriasis. These things are there. ठीक है. Bronchoconstriction, यहाँ पे bronchodilation. So what are drugs you give here? Organophosphate was cholinergic in nature. Opposite क्या देना आप? Anticholinergic देना. Now let us look anticholinergic कौन सा है इसमें? Atropine है, flumazenil है, ठीक है, NAC दिया हुआ है यहाँ पे. Then what we have? One more thing is oxime, pyridoxime, etc. NAC क्या है? N-acetylcysteine. We'll talk about that. The first one, remember, organophosphates are irreversible blockers of the enzyme called as acetylcholinesterase. Acetylcholinesterase is the enzyme that breaks down acetylcholine so that acetate and choline break down हो जाता. Choline is uptaken by the nerve ending. This is what happens normally in acetylcholinesterase. We give a drug like neostigmine and physostigmine and all, they will irreversibly cause problem. What is irreversible? Blocked kata. Continuously acetylcholine will rise and cause all those problems I told you. Dumbbells will happen. ठीक है. Overstimulation of muscarinic receptors and nicotinic receptors and CNS. All of these things will happen in this. And you have the symptoms of dumbbells. ठीक है. Now, why is atropine used? Opposite of dumbbells. You want to block those actions, no? It's a competitive muscarinic receptor antagonist. Remember? Antagonist है वो. ठीक है. It's a life-saving drug. Until when do you give that? Till when do you give? Do you see that his lips are becoming see, when you are taking cholinergic, it's a muscarinic kind of drug, secretions will increase. So if a person is coming with OP poisoning, he will be having diarrhea and urination kar diya wo, and he's having sweating and everything will happen. Till when do you give atropine? Till all of this stops. You can't keep on checking, अरे पेशाब करा नहीं करा and all. You look at the lips and all dry हो जाते हैं. मतलब क्या है? Yes, it has started working. ठीक है. Dries the secretions. Bronchospasm will be relieved. Heart rate will be better. ठीक है. Because what was the cholinergic drug doing? What was the organophosphate doing? Slowing down the heart rate. Bradycardia. This will cause a little bit increase in heart rate. ठीक है. Remember that. Okay. नेक्स्ट क्या अदर ड्रग्स क्या दिया है फ्लोम फ्लोमाजिनिल फ्लोमाजिनिल क्या था बोलो इट वाज फॉर बेंजोडाइजेपिन नॉट फॉर व्हाट इज ऑर्गेनोफॉस्फेट्स नेक्स्ट क्या एन एसिटाइलसिस्टीन इज मेजरली फॉर पैरासिटामोल पॉइजनिंग 10-15 20 गोलियां खा लिया दैट्स अ प्रॉब्लम देन वी हैव ऑक्साइम्स क्या है pralidoxime pralidoxime is what it's a drug that reactivates it can be used but it's not a life saving drug first is atropine so you have two drugs which are right over here but drug of choice this will not oximes will not save him atropine will save him life saving drug of choice usko bolte hain see confusing trapping first give atropine then go for then go for fluoxetine also first drug of choice kya hai remember drug of choice is going to be atropine very good ठीक है that's going to be your answer for question number 11 what is that atropine remember that right next what we have pheochromocytoma what is the pre-op drug for pheochromocytoma what is pheochromocytoma any idea what is pheochromocytoma is it going to be a condition where there's raised blood pressure etc and all yes it is a problem with your what adrenal medulla what is there in the adrenal medulla where is the adrenal gland first right oximes in carbamate poisoning no we can't because it does not work there carbamates are very dangerous ठीक है carbamates हो तो literally you have to go for symptomatic treatment and just hope he survives ठीक है there's a timing there's a aging of the process remember that Sagar the aging and even oximes will not work if you come after 15-20 years आके या he took this बोल के ऐसा comedy में बोले नहीं कर सकते it should be treated as soon as possible ठीक है right before it completely blocks so age for example aging of that enzyme aging बोल के will be there in your notebooks in your textbooks not in your notes textbook में aging of the action so what happens over there aging अगर हो गया time हो गया even oximes pralidoxime 2-pam बोलते हैं उसको 2-pam it will not work okay now pre-op drug for pheochromocytoma पहले क्या है वो तो बोलो यार what exactly is pheochromocytoma tell me the name is very weird here ठीक है colorful chromo this is going to be your area oma मतलब क्या है there's going to be some kind of growth or it's going to be your what a kind of a tumor so excessive something is going to be there what excessive what first thing it's going to be a tumor of the adrenal medulla मतलब क्या होता है adrenal gland कहाँ है पहले adrenal gland is above the kidneys two are there yes there's going to be a cortex there's going to be a medulla simple cortex 1 second there's going to be a cortex this is the cortex and inside is going to be a medulla remember that yes oh, very good who is that shamika catecholamine releasing tumor very good so inside the cortex is going to be your 3 layers ठीक है we'll get to that later on जहाँ से सबसे यहाँ थे but inside that is your medulla के अंदर for example this nice place ना nice cat can sit inside and rest nice area for cat to rest cat for catecholamines remember that it's a nice place for cats to rest so catecholamines याद रखो catecholamines कौन से है बाबा catecholamines is going to be your epinephrine norepinephrine these all will cause what blood pressure to increase okay blood pressure अगर increase हो रहा what drugs do we give किसी का ब्लड प्रेशर बढ़ा हुआ है तो क्या ड्रग्स देते नॉर्मली लॉल ड्रग्स व्हाट आर लॉल ड्रग्स हियर अल्फा बीटा 5 alpha reductase pd inhibit we go for beta blockers be ready कैसा भी है बंदे को there is going to be a problem so you go for giving beta blockers remember that so look at this no not beta alpha blockers not beta blockers in this case beta blockers nahi alpha blockers right look at this now the correct answer over here the correct answer now let us understand why alpha blockers but not why not beta blockers suddenly beta blockers बोल दिया now look at this pre-operative drug बोल रहा है now if you look at the blood vessels majority कौन से हैं alpha receptors है not beta receptors ठीक है alpha receptors है not beta receptors so when we know that the things that are released from the medulla are going to cause blood pressure to increase. What is involved? Alpha receptors involved. So alpha को पहले pre-operative block करके रखवा. Look at this. Pheochromocytoma is a tumor of the adrenal medulla. It will release what? Epinephrine, norepinephrine. What will it cause? Severe hypertension, arrhythmias during surgery when you try to remove. Okay? Be very careful. So alpha blockers are given. Why? Excessive catecholamines will go and cause the action of the receptors. What action? Vasoconstriction. Vasoconstriction will lead to severe hypertension. This was because of the action of these drugs on the alpha receptors, because blood vessels have more alpha than beta. More alpha than beta. Of course, beta blockers can be given, but alpha is majority reason. तो क्या हो रहा है यहाँ पे? It causes vasodilation, reduces the BP. Intraoperative crisis. Crisis मतलब क्या है? अरे इसका BP बढ़ गया, he will have a problem. Be careful. Already treat him with alpha blockers and be ready. ठीक है? Very important. Never give beta blockers before alpha blockers. ठीक है? Beta blockers alone दिए तो सिर्फ alpha action full high हुआ था. Massive vasoconstriction होता. Don't give alone first only. ठीक है? Beta blockers can be added. Yes, it can be added, but first alpha blockade करो आप. ठीक है? Why? Because beta blockers will help you reduce the tachycardia. ठीक है? Blood vessels पे नहीं है उसका action, heart पे. ठीक है? That was the मैं इसलिए बोला हूँ. First is blood vessels. The action is majority of the blood vessels are which receptors? Alpha receptor. So first do that. Hypertension हो रहा उसको. So give this to reduce the hypertension. Alpha blocker दियो. Then you give beta blocker. PD inhibitors not used over there. It's going to be used in ED conditions. ठीक है? Erectile dysfunction है तो ED condition में देते हैं. Next क्या है? Pheochromocytoma, of course. Remember alpha block, then beta block, then you go for a surgery. Do not even try because there will be a crisis. Okay? Remember that. Okay. Now that is going to be the answer for this. First, what do you give? Pre-op drug. दोनों भी answer. Alpha blockers or beta blocker. Which is more important? Alpha blockers. Say alpha blockers. Like what? Some drugs you know about alpha blockers. Let us see. Tell me any drugs related to alpha blockers. Name of some alpha blockers. Prazosin, tamsulosin, terazosin, doxazosin, phentolamine. ठीक है? ये drugs भी है. Remember that. Next what we have, see, the answer is going to be alpha blockers. Next what we have is going to be your FMGE 13th question. What is it? What is the preferred drug for what? Cryptococcal meningitis. Very dangerous condition. You know how does it occur? That bird feces near your windows coming inside the house. You are looking outside. Ah, so nice, fresh air. बोल के अंदर cryptococcus आता. Yes. Very दिमाग खराब. Be very careful. ठीक है? So in this preferred drug of course, yohimbin. Wait. Where is yohimbin? Tell me. Yohimbin is the alpha blocker. Yes, but alpha 2 blocker, not alpha 1 blocker. You don't give yohimbin here. Okay? Right, Sagar? Okay? Now, prazosin was right. Prazosin, tamsulosin, terazosin, doxazosin, sin, and phentolamine भी है उसमें. Metazapine, alfuzosin. Very good. Okay? Chalo, right. Now come to this cryptococcal meningitis in excuse me. What do we give in cryptococcal meningitis in HIV? The answer majorly over here is what? Voriconazole है, liposomal amphotericin भी है, very very dangerous drug. Fluconazole and flucytosine and fluconazole का combination है. And the answer here, we'll see what we can do. In cases of HIV, I don't know, full question नहीं आया. Cryptococcal meningitis in HIV की बात कर रहा हूँ. पहले ही HIV में क्या हो रहा है यार? What is HIV? What is HIV? What is HIV? Human immunodeficiency syndrome. ठीक है? मतलब क्या हो रहा है उसमें? उसमें पहले ही उसकी क्या बोलते हैं उसको? What do you say? The immunity is completely obliterated. ठीक है? The body is unable to fight infections. ठीक है? So something called as opportunistic infections are very high in these cases. ठीक है? So we have to be very careful with the proper medications to be given here. Remember that. Advanced HIV cases where the CD4 count has gone all the way less than 100. CD4 are what? CD4 are your T cells. Very, very important cells for your immunity. count has gone very low. ठीक है, ठीक है, very very bad. It causes damage. Then infection from cryptococcus, yes, cryptococcus can be very commonly seen here because immunity नहीं है उसको fight करने की. Headache, necrosity, seizures, ये सब features है यहाँ पे. So what do we go for treatment over here normally? Cryptococcal meningitis has phases. What phases? First is induction phase. Induction phase में what do we do? Amphotericin B and flucytosine दोनों देते हैं. ठीक है? One second. Can you hear me? I don't know. Am I live? Hello? Okay. Now, see, the treatment strategy involves what? First thing that we have is going to be amphotericin B and flucytosine together in the induction phase. Then, in the maintenance phase, we give high dose fluconazole. Now, the question says preferred antifungal regimen, so combination therapy should be given. Khali amphotericin B, this in this option, the best option that is there, combination therapy is there. Even though amphotericin B should be given, but option many, you can't be like question is wrong, but so combination therapy is the best answer that you can select over here. That we give flucytosine, yes, we give along with fluconazole also. Flucytosine is given along with amphotericin B only in the starting induction phase treatment, whereas fluconazole for what? Maintenance therapy. Yes. So what do? We give a combination answer. This is very, risky. You're like, yeah, sir, I know my answer is fluconazole also, amphotericin B also. Voriconazole is wrong answer. Yes, of course. It's not used for this. It's used for aspergillosis. Fine. Only amphotericin B will not work. So I think that is not the answer. Only fluconazole is given. Yes, but in the second phase. So it's better to go for a combination. Okay? Right? So that is the answer. Remember that. HIV plus meningitis is going to be a cryptococcus meningitis majorly. Combination. Actually, the best one is amphotericin B and flucytosine in the first phase, induction phase, and then fluconazole for maintenance. Got it? Yes. So the combination one wins the race here. So sorry. It's very high viral fever, viral cough, and etc. going on. All of you, take care of yourselves. Take proper medication on time. Okay. Right. Now what do we have here? The next question is folinic acid. Next question. Answer here is what? Flucytosine plus fluconazole. Okay. Now coming to the next one. What is the next one? Folinic acid. We read about flumazenil. We read about other drugs. ठीक है? Methanol poisoning में fomepizole देख लिए. But folinic acid we read somewhere, no? In that only one option was there. Folinic acid कहाँ use करें? Let us look at these things. Methotrexate. We have read about it. Cisplatin. We talked about nephrotoxicity that happened over there. Vincristine, vinblastine we talked about. 5-fluorouracil. We didn't talk about that. We'll see that. But majorly, folinic acid is going to be the action for methotrexate toxicity. Okay? It's a major drug used for methotrexate toxicity. Methotrexate is what? It's an anti-cancer drug. Very commonly used. MTX. MTX. वैसा. तो याद रख लो MTX. It's used majorly as an immunosuppressant. ठीक है? Immunosuppressant action रहेगा उसका. ठीक है? It inhibits what? It inhibits a very important enzyme called as DHFRase. What is DHFRase? Dihydrofolate reductase. DihydroFRase folate reductase. Rase is reductase. ठीक है? Remember that. Why methotrexate is toxic? Now, the thing is that it blocks the conversion of the enzyme DHFRase, no? When it blocks the conversion of folic acid to tetrahydrofolate, do you require tetrahydrofolate in your body? Do you require tetrahydrofolate in your body? Yes, of course. Folic acid is required. If you can't use that, what happens? If you can't use folic acid, it affects your DNA. DNA problem, dividing cells are affected. So when that dividing cells are affected, your bone cells are affected. Bone cells में क्या हो रहा है आपका? Your bone marrow suppression. When there is bone marrow suppression, what can happen? Bone marrow है. Bone marrow is majorly, involved for what? What exactly? क्यों use करते हैं आप bone marrow? Tell me. It has the cells for RBC production, platelet production, WBC production. The whole family of RBCs, WBCs and all are made in bone marrow only. True? When you suppress that, what will you reduce? All three of them. Platelets will reduce. Then what else will reduce? RBCs will reduce. WBCs will reduce. So when platelet reduce, he will have some kind of problem with the bleeding because thrombocytes. If RBC reduce, he will have anemia. If WBC reduce, he will have infection. So be very careful. ठीक है? Sorry. So remember that folinic acid क्या करता? Folinic acid, of course, is an active form. ठीक है? Leucovorin बोलते हैं उसको. ठीक है? It's called as leucovorin rescue बोलते हैं उसको. ठीक है? Remember that. It will literally do what? It blocks step. It bypasses the blocked step. Therefore, helps the action. ठीक है? Now cisplatin toxicity. What do you give? Something called as amifostin along with some proper hydration. Vincristine, neurotoxicity hoti, we try to treat that. And 5-fluorouracil we'll treat with something called as uridine triacetate. We'll give this paper for you. I'll give this PDF. Some pure answers, give it a reading. Okay, it's very simple. I want to go in each and every answer. It becomes very long. We are still in question number 14 only. Take, we are done with almost an hour of class and just 14 questions are done. Take care, we have to do 40 questions. So let's go a little bit fast. I'll give you the PDF, of course. You can look into it. Now, methotrexate toxicity. Remember, we give what? Folinic acid. Now, do not write. They will mention folic acid also. Folic acid is not given. Folic acid दिया तो काम नहीं करता यहाँ पे. Folinic acid, folinic. Remember that. ठीक है? Folic is not same. This is a very common trap that they use. Folic acid. हाँ यार folic acid देते हैं. No. Do not give folic acid. ठीक है? Folic acid is what? Which vitamin? B. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. इतने पूरे है? नहीं है. क्या क्या है? A small recap. B1 is, right, 1 becomes a T. So thiamine. B2 is a 2. Becomes like a R. Let me write on those just for you guys to remember for the exam also. Remember, there's going to be B1, 2, 3. Is there any 4? No 4. So it's going to be 5, 6, 7. Is there 8? No 8. 9 and 12. Sorry, 12. Okay. Now 1 में क्या है? 1 लिखो. 2 में 2 लिखो. 3 में 3 लाइन डालो ऐसा 3 लाइन. 1, 2, 3 लाइन्स. 5 में 5 लिखो. 5. And then 6 में 6 को उल्टा करो ऐसा. And 6, what happens? There's an X in this now. There's also going to be having an X in this. 7 is going to be your what? 7 हिंदी में क्या बोलते हैं? साथ में है आपके. साथ में कौन रहता? We'll see. Don't worry. 9 is going to be like an ulta 9 or folic acid or folic acid. Folic, not folinic. Folic. Okay. And 12 is going to be your cyanocobalamin. Long answer. Long name. Now, 1 जो thiamine है ना, जानो T लिख के because thiamine बनाओ. Now remember this thiamine है, it is not thymine. This is different. ठीक है? What is this? Pyrimidine, cytosine, uracil, thiamine बोलते हैं ना, that is Y. This is I. Don't confuse. ठीक है? Next 2 का लिख के इसको बनाओ आप R बनाओ. Riboflavin. N को बनाते आप niacin. P को क्या करें? 5 for 5 no? Pantothenic acid or pantothenic acid. 5 pantothenic acid. 6 X है ना? तो इसमें भी pyridoxine. X आता है इसमें भी, X इसमें भी आता. ठीक है? Next क्या है? Who's there with you? साथ कौन है? Who is साथ? Who is always there with you? Your भाई is with you. Your भाई. So biotin. Okay? याद रख लो biotin. ठीक है? Folic acid and cyanocobalamin. Very simple way. Very simple way of remembering. ठीक है? Right. So methotrexate में क्या है? Folic acid? No. Folinic acid. ठीक है? Remember that. Now, what is therapeutic index? What is therapeutic index? Remember. क्या है therapeutic index here? Any idea? Will it tell you about the toxicity or the working of any particular drug? Yes. Remember, whenever you give a drug, what happens? You have to reach a level where it will show action. I cannot say paracetamol, chato, you'll get action. यो सर में दर्द कम हो जाता है, ये हो जाता है, वो हो जाता है. This is not magic. You have to take a minimum tablet. No, no, बच्चे को ना भारी से चटा हो जाता. अरे नहीं होता यार, वैसा नहीं होता. ठीक है, मेडिसिन है ये, कॉमेडी नहीं है. So what happens, tell me. Let me see if you guys can hear me actually. Is there a problem with my voice? Okay, right. So you have to reach a level. ठीक है, that is effective level. Effective level चाहिए आपको. And or else you reach a level that can cause toxicity. मतलब क्या है कि एक level रहता है जिसमें आपको effect दिखेगा and level रहेगा जिसमें आपको toxicity दिखेगी. That means you'll see level that can show effect and a level that can effective level or effective dose, toxic dose. Between is what? The range of your drug. Sir, how many numbers? 50% of people showed effect in this dose. 50% of these people have showed toxicity when they have taken this dose. So that means 50-50. LD 50 by ED 50. Yes, Shamika, you're right. So therapeutic index is going to be what? Tell me. 50 LD 50 by ED 50. But let's look at the other options also. TD by MLD. Okay, what is TD? Therapeutic dose by MLD, maximum lethal dose. No. First pass metabolism. Completely. What is first pass metabolism? Anyone? First pass metabolism is going to be when you take a drug. It's like customs office at your customs office. कैसा था? You guys are coming from outside, no? You know customs office. Someone will call you, get an iPhone from somewhere here. चाइना से आ रहे हैं, कहीं से भी आ रहे हैं. Get an iPhone. आप iPhone लेके आते हो तो उससे. iPhone लेके आए आप. और custom office will ask you to pay the full amount or half amount or some amount. Custom office will take. That is what the liver does. ठीक है, first pass metabolism, something when you take in the GIT, it passes through the portal circulation and comes to the liver. Liver को आ गया. When it comes to the liver, what happens? Tell me. When it comes to the liver will say, निकालो थोड़ा. So it will undergo some percentage of what? Removal. ठीक है, maybe 50%, maybe 30%, maybe sometimes 100% also is gone. Nothing comes into the circulation only. You took the tablet, it went away. Action zero. Why? Completely liver has utilized it and metabolized it and said data bye bye. ठीक है, understood? Yeah. So that is one thing. But that's not the answer here. Therapeutic index does not show first pass model. Bioavailability. वो भी नहीं होता. What is bioavailability? How much of the drug is actually available for action? IV दियो 100% है. What is it? Give a oral drug. GIT के तो जाता. Depends on which kind of drug, which kind of first pass metabolism will happen. Now remember, first pass metabolism का दूसरा नाम क्या है? Anyone? What is the other name of first pass metabolism? Please tell me. First pass metabolism का मतलब क्या होता है बोले तो it's going to be before the drug gets into the circulation. Pre-systemic circulation. Pre-systemic में निकालने से pre-systemic elimination कर रहे हैं आप. Before it gets into systemic circulation. Remember, the other name of first pass metabolism is going to be pre-systemic elimination. Understood? Yes, that's very important. Next, what we have, okay, after that, therapeutic index is done. Yes, what is the answer here? LD 50 by ED 50. The next question is going to be your treat management of severe Plasmodium falciparum malaria. We'll take a two minutes break and then we'll come back to this. Okay, be online. I'll join back. Okay. Okay, right. We are back. We are back now. Let's get back to the questions. Okay, one second. We are back now. Let's get back to the questions. Let's see what is the next question that we have. After we've done the 15th question, the 16th question is going to be the treatment of Plasmodium falciparum malariae with altered sensorium. What can we go for? Okay, these drugs. Let us look at the drugs. Are these drugs actually used for treatment of malaria? Let us see. Chloroquine, yes. Artesunate, of course. Quinine, yes. Primaquine, yes. So now you know all the four drugs are right for treatment of malaria. I did not go into altered sensorium, Plasmodium falciparum. I didn't go there. They are known to be treatment for malaria. Okay, fine. What is the maximum problem of best treatment in the place of falciparum malaria? Let's see that. Okay, now what exactly do we have your options? Chloroquine is commonly used. Yes. Okay. But the answer over here is what going to be what? Tell me. It said altered sensorium. It said altered sensorium. What does it mean? What does that mean? Tell me. Severe or complicated malaria में ना sensorium they won't know, don't know where the situation, what exactly the people are there here and there moving around. Sensorium means what? He does not have the sensation properly. ठीक है? No proper where am I kind of situation. ठीक है? Fever with chills and rigors etc. and all of these things are seen. Now classification of malaria we should know this uncomplicated malaria. ठीक है? कुछ भी organ का problem नहीं है बस fever है chills है etc. Uncomplicated. But when it goes into severe, very important, there's going to be coma or altered sensorium, does not know where he is, what is he doing, etc. ठीक है? What is it? Tell me. Any one of the following will happen. Like what? Altered sensorium, severe anemia, renal failure, respiratory distress syndrome, hypoglycemia, or acidosis. All of these things are complicating the malaria. Remember that, complicating the malaria. Severe malaria हो जाता है. And the severe malaria treatment is always going to be your artesunate drugs. Why? Because the action of these artesunate drugs is very nice. The action of artesunate drugs is very good and very fast also. Rapid, rapid action on what? Schizonticidal action. मतलब क्या? Schizonts बनते हैं ना उसके मलेरिया में, उसको मार देता है. Very fast action, helps you a lot. Acts on all blood cells. Let it be starting, ending, middle, whatever. It will kill every stage of malaria. Good for you. ठीक है? Reduces parasite load very quickly. Can be given intravenously also. ठीक है? Best treatment for severe conditions is artesunate. Why are others not the right answer here? Why are other drugs not the right answer here? Let us see. Other options. Chloroquine. Yes. Chloroquine given with sulfadoxine and pyrimethamine. Combination है ये. ठीक है? Severe malaria में काम नहीं आता. Uncomplicated malaria में it is good. Severe में it does not have the effect on all stages. Rapid action नहीं है, etc. नहीं है. Quinine, very old drug. Toxicity is very high. And one more thing, it affects your heart. Quinine, remember, in what? Arrhythmic drugs. Yes, quinine, yeah? Effects are there. Primaquine, used to kill hypozoonosites, not for severe malaria cases. So all of these are used, yes, in malaria in different phases, but not in the severe malaria case. So severe is going to be your IV artesunate. Fastest action on schizonticide. Okay, that's what you want. All the stages are killed. You want that only, no? You want Superman, no? You don't want Green Lantern and everything. Remember that. Now, next question that we have is going to be your anti-glaucoma drug contraindicated in asthma. Very nice question. Very nice question. What is glaucoma first thing? What is glaucoma? I'm waiting for an answer. Come on. What is glaucoma? Now glaucoma दिमाग में first this something that people are like raised intraocular pressure sir. नहीं होता यार. Raised IOP is different thing. It's not always a part of glaucoma. Raised IOP is not always seen in glaucoma. Remember that. Atovaquone, yes, no, it has its own side effects ma. ठीक है? Atovaquone is there, yes. ठीक है? But it has its own side effects. Cannot be used in severe conditions. No, we need the one that acts on all phases. Okay, Sagar? Yeah, right. Now, so glaucoma में क्या कर रहे हैं आप? What is glaucoma? I told you, glaucoma is a condition of the eye. Okay. So raised intraocular pressure? No, that is wrong answer. Why is raised intraocular pressure the wrong answer? Please tell me. क्योंकि it might be raised. Now let me remind you कि glaucoma can happen in normal also condition, normal IOP also, as well as low IOP tension also, low IOP also. It is called as NTG, normal tension glaucoma. It's also called as low tension glaucoma, LTG also. So now can you say that raised intraocular pressure is glaucoma? No, you can't say, because glaucoma is not equal to raised IOP. It's a different thing that most of the cases, most, I didn't say all, most and all में बहुत फर्क है. Most of the cases have raised intraocular pressure. It might be a factor causing damage, but that does not define glaucoma. Low tension and what is say normal tension also is there. So problem क्या है glaucoma में? Problem is your optic nerve damage. Glaucomatous changes in the nervous part of the eye, and these are irreversible changes. Suddenly नहीं होता glaucoma. It takes time, and you start seeing spots in your vision field. I can't see that side, sir. I can't see this side. So that is scotomas on the visual field. You can't see stuff. That is going to be your what? Glaucomatous field problems. So what can we do? What can we do in this condition? Now glaucoma में the major thing is there are different types. ठीक है? Different types क्यों? First thing glaucoma में you have congenital glaucoma. ठीक है? By birth. You can treat that as well with the surgery. And the other type is something called as open angle glaucoma, and the last one is something called as angle closure glaucoma. Now, don't say closed angle glaucoma. Don't say that. Now, which angle are we talking about? Let us look at the diagram once. Which angle are we talking about? Assume this is the lens. Okay? This is your iris, and this is your cornea. This is called as what? Which angle is it called? Please tell me. Which angle is that called? That angle is called as iridocorneal angle. And which segment is there? Let me just remind you. The eyes are divided into two segments and two chambers. Two segments and two chambers. Where are those segments or where are the chambers? Let us see. ठीक है? Now, आई जब देखते ना आप, ठीक है? आई के पास जो है यहाँ पे आपका what is this? लेंस है. यहाँ पे कॉर्निया है. यहाँ पे आइरिस है. लेंस के पीछे everything behind the lens is your posterior segment. Posterior segment. In front of the lens is called as anterior segment. In the anterior segment is this part. In front of the lens, this is going to be your posterior chamber, anterior chamber. Okay? This is your posterior chamber and anterior chamber. Okay? Right, all of you? Remember that. So we have two segments, we have two chambers as well. Understand that concept. Now, क्या देखो, ग्लोकोमा में क्वेश्चन क्या है यहाँ पे? एंटी ग्लोकोमा ड्रग. नाउ वेयर व्हाट ड्रग्स डू वी यूज हियर फर्स्ट? ग्लोकोमा में प्रॉब्लम था इंट्राओकुलर प्रेशर. वो द प्रॉब्लम वाज बिकॉज आइदर देयर इज टू मच प्रोडक्शन ऑफ एक्वस ह्यूमर और देयर इज नो प्रॉपर ड्रेनेज ऑफ एक्वस ह्यूमर. ठीक है? इसमें ड्रग्स यूज होने वाले कौन से रहते हैं? वी हैव ड्रग्स लाइक प्रोस्टाग्लैंडिन एनालॉग्स लाइक क्या बोलते हैं अपने ट्रेवोप्रोस्ट, लेटेनोप्रोस्ट, राइट? देन वी हैव ड्रग्स लाइक what? Beta blockers like timolol. What does it do? What do these do? They will reduce the aqueous humor. So is timolol there in this? Betoxolol, pilocarpine, brimonidine, timolol. Timolol is a beta blocker that is used for treatment in glaucoma. Remember that. Can we give timolol in a person having asthma? What is asthma? What is asthma? Asthma is a condition where in your bronchi it will lead to constriction and सांस लेने मुश्किल हो रही सर. Why? Because there's going to be a complete closure of your bronchus. You do not give blockers there. You take salbutamol to open it up. आप timolol दिए, in some rare case it will come and cause action. सर और ड्रॉप्स दिए थे ना बहुत ज्यादा ले लिए, मे बी इट गॉट इनटू सर्कुलेशन, केम हियर, स्मॉल अटैक, इट विल लीड टू bronchoconstriction. Do you want to take that risk? No. Yes. Brittle bronchial asthma, not brittle. Yeah. Okay. So remember, asthma case में you do not give what, lol drugs, blockers नहीं देते. But in glaucoma, anti-glaucoma, one of the treatment is timolol. ठीक है? Pilocarpine, betoxolol, brimonidine, these things are there, but they are not going to affect your asthmatic patient. Timolol will. ठीक है? Timolol will, because it's a beta blocker. So that is the answer for this. Simple answer. ठीक है? Yes. Next question. See, answer is timolol. Now, what is it? Next. This is a very nice simple drug. Simple drug. देखो याद रखने के वास्ते आसान है. देखो. Look at this. Long acting insulin without peak. Long acting. Lispro, aspart, glulicine and glargine. Okay. Lispro, aspart, glulicine, glargine. इसमें इतना simple है इसके नाम. आपको remind you the names. The name you listen and you like, this is the answer बोल के. क्या बोल रहा? Long acting है. ठीक है. Short acting है. Intermediate acting है. When you listen the name Lispro, does it sound like less pro? Less, no? So it is a short acting. As part, as a part, as a part means what? Small part of it, no? As part also is going to be what? Tell me. Short acting. Glulicine, lessine, short acting. Glargine, right? Going to be what? Large, long acting. और एक है ड्रग यहाँ पे डेटिमिर डेथ तक, ऑल द वे टिल डेथ मींस वेरी लार्ज. अभी पैदा हुआ बेचारा, डेथ की बात कर रहे हैं. सो टिल डेथ, लॉन्ग टाइम कुड बी. नेक्स्ट क्या है? डेक्लूडेक मतलब क्या था? DECGLU DEC is December to December, 1 year, long time. So remember, these are easy ways to remember that. Lispro, short. As a small part, short. Lessine, lessine, short. But glargine एक है, that is going to be what? Large. Long acting. Glargine is long acting. And detimir till death. याद रख लो. Detimir is going to be long acting. And degludec is going to be long acting. Easy? All of you? Okay. Next what we have? The question C. Very simple. What is the long acting one? Glargine. Next is going to be antidote for morphine overdose, naloxone, naltrexone, nalmefene, methadone. Let us see. Now look at this. Other drugs are also there. Can use or not use, etc. We'll see that. But अपने को चाहिए antidote. Overdose हो गया तो you can't be waiting for long. सुकून से देंगे इसको, no problem बोल के नहीं कर सकते. जल्द fast action. So answers are right. But the now thing is overdose हो गया उसको. So for emergency जब का जब देना है तो what is the drug name? Naloxone. ठीक है? When a patient comes with morphine overdose, what happens? Is going to be opioid overdose will come with pinpoint pupils, respiratory depression and coma. Remember this, pinpoint pupils, completely ऐसा हो गया pinpoint. ठीक है? Light डाले तो भी effect नहीं होगा. Next क्या है? Respiratory depression because it affects your respiratory center in your heart, brain. And coma because it gone to case. Opioid toxicity है ये. What is drug of choice? Purely directly opioid antagonist के against act करता, so it is going to be your naloxone. Goes to a receptor called as mu receptors, mu. Mu receptors पे जाके बैठ जाता, it will cause good effect. Rapidly reverses respiratory depression, rapidly reverses CNS depression. Helps in these cases. ठीक है? Next, of course, naloxone has a half short life. And morphine has a very long half life. So what happens? हाफ लाइफ उसकी लॉन्ग थी, इसकी शॉर्ट है. मतलब कि आपको naloxone रिपीटेड डोज देते रहना पड़ेगा. You have to keep on giving naloxone till it reverses. Okay, it cannot be single dose. Keep on giving naloxone for longer period of time. Why are the other options wrong? Naltrexone is of course it is a drug that can be used in opioid overdose, but for long acting opioid antagonist. De-addiction may, but not in emergency. So answer naltrexone is not wrong for more. What is it, this thing? But it is used for what? Overdose के वास्ते, de-addiction के वास्ते, but not for emergency. Nalmefene, again, nalmefene is not for opioid, it's for alcohol dependence. Next is methadone. Methadone is long acting again. Methadone can be used, but long acting is opioid substitution therapy. Methadone can be given. So remember, acute condition where overdose, sudden action चाहिए आपको overdose के लिए, so you'll be using what? De-addiction के लिए naltrexone. जब का जब action के लिए what do you need? What? Naloxone. Got it? So naloxone will act on which receptors? Mu receptors. Okay, right? Chalo. 19th question also is done. 20th question. Answer was naloxone. Remember that question. Naloxone was the answer. Next, what we have? Digoxin induced ventricular arrhythmia. Digoxin क्या है यार? Tell me. Digoxin is a very important drug which will cause excessive pressure in the जोर से मारता heart. Pressure. Inotropic action is there. Digoxin. But it's one of the drugs which has a very low therapeutic index. Careful. Okay? You cannot give a higher dose. It'll cause damage, etc. and all. It might lead to what? It might lead to a problem. Okay? Right? Okay, 1 second. Just 1 second. Hello. Yeah. So, coming to the next question that we have that we're going to go for. Right. Okay. So we have what do you say? Antidote for morphine overdose done. Next, what we have, the question is going to be your digoxin induced. Of course, we are talking about that. Digoxin induced. Let's go for it. Now, digoxin induced ventricular arrhythmia. We have talked about it. Digoxin is a drug that is inotropic in nature. Remember, inotropic मतलब क्या होता है उसका? It's going to cause the force of contraction of the heart to be increased. Therefore, it's used in conditions like what? In conditions like heart failure. Heart failure का problem क्या होता है? The heart is unable to pump the blood properly. So let us see what exactly which drug can be used in a condition that can be because of a problem where you induce it was induced by the production of by the production of ventricular arrhythmia by the drug. Okay, remember that. So what do we have? Digoxin toxicity causes a condition called as ventricular arrhythmia and also called as AV block, atrioventricular block. Now, mechanism क्या है? Because of too much of intracellular calcium, and that causes automaticity of these, activation, therefore causes arrhythmic loss of the proper rhythm. Why is lidocaine going to be a treatment over here? Lidocaine क्यों? What is lidocaine? It's a local anesthetic, but no. Lidocaine is over here is going to be used as a class 1B antiarrhythmic drug. Class 1B antiarrhythmic drug which suppresses ventricular ectopic activity. What is ventricular ectopic activity? What is ventricular ectopic activity? Unwanted development of activation of this cardiac cycle that causes the heart to go faster and faster, loss of rhythm. Therefore, you reduce that. So remember, it does not worsen the AV conduction. Therefore, the conduction does not happen. So cycle does not cause more and more and change in the heartbeat. Heart rate नहीं खराब होगा. Safest antiarrhythmic in digoxin toxicity is going to be a lidocaine in that case. Atropine दे सकते हैं? No. It's used for bradycardia. ठीक है? Not for condition like this. Bradycardia है, give atropine. It will increase the heart rate. Not for ventricular arrhythmias. Amiodarone. Amiodarone is used for, of course, amiodarone might lead to raising the levels of digoxin. Do you want that? No, it will become worse more. ठीक है? Do not give amiodarone in that condition. Procainamide. Procainamide also can aggravate the condition. So last two, amiodarone and procainamide, actually can cause more damage. So be careful. Do not give that. Give atropine. No. Atropine is used for what? Bradycardia. Lidocaine is a class 1B antiarrhythmic drug that can be used over here. Okay? Very, very important. Okay? Now, the next question that we have, question number 21. We're done with half of the questions. Right? Question number 21. क्या है बोलो? Drug for nasal MRSA carriers. What is MRSA? What does MRSA mean? What is MRSA? Tell me. MRSA means methicillin resistant staph aureus. क्या है वो? Methicillin resistant staph aureus. And remember, nasal carriers बोल रहा हूँ, मतलब it's going to be there in the anterior nares. They will spread it. ठीक है? Now look at this. Why is this question commonly asked? Because MRSA carriers, of course, are seen having the MRSA infection in the anterior nares in this area. ठीक है? They are asymptomatic in nature, but they are reservoirs. They will take it from some place, hold it, and then go somewhere else. They will spread it. They will be the reason for the spread of MRSA infection in people. People who have immunity that are bad, khatam, gone. What is hospital infection called? Nosocomial infection. Remember that, nosocomial. Okay? याद रख लो. Now in this case, what can we give? In this case, what can we actually give? Tell me. What are the options here? Vancomycin, teicoplanin, mupirocin, linezolid. Now I said carriers. Carriers मतलब यहाँ क्या है? Nasal carriers है. They don't really have, they're asymptomatic. They don't have the damage so much. They're just carriers. So do you make them go through drugs so difficult? Vancomycin is a big tablet. ठीक है? Very important. It's going to be toxic. Linezolid is very toxic if taken without any reason. Teicoplanin also is one of the drugs like that only. But mupirocin is an ointment. Can you use that ointment and kind of help you in treatment of that localized areas of containing carriers? Right? See, why is mupirocin the right answer in this case? Very, very tactical question. Okay? Remember that. Mupirocin is a topical antibiotic. Okay? It inhibits the growth of what? What is this? MRSA. So it helps what? It causes inhibition of the tRNA synthase, blocks protein synthesis. Therefore, growth does not happen. Carrier level कम हो जाता. They become less infective. ठीक है? Now, it can be used as ointment on these areas. ऐसा लगा सकते हैं. It will help you reduce the MRSA carrying capacity of that patient. It is very helpful. ठीक है? Helpful in eradicating nasal MRSA colonization. Nasal MRSA colonization can be reduced by using mupirocin ointment. Remember, MRSA देखते कि दिमाग में vancomycin बोल के क्या आते? मत करो. Don't make that mistake. ठीक है? The answer is what? Mupirocin. Why is vancomycin wrong? It's an IV drug. Systemic infection के लिए, not for local infection. Too much to be given. He's like, I am feeling hungry, daddy. Give him biryani. Biryani क्यों देते यार? Give him some milk. Give him some biscuit. He didn't say, I'm very hungry. I want to go and eat a horse. नहीं बोला ना, right? Next क्या? Teicoplanin. Teicoplanin is vancomycin's brother. Do you want to give? No. Systemic थोड़ी है. It's a infection in the nares only. So helpful. Next क्या? Linezolid. अरे यार, danger drug है. Danger. Serious MRSA and even वर्सा infections. What is MRSA? Methicillin resistant. What is वर्सा? Vancomycin resistant. So उसमें, in this case, he said nasal MRSA carriers. मतलब this is going to be only localized to these areas. And what can we use? Linezolid का cream वो तो नहीं आता. म्योपिरोसिन लियो, सही से लगाओ, it will reduce. Understood? He does not have any other condition, वो infection नहीं है. ठीक है, very very important. We are trying to go for something called decolonization of that area. Understand that concept. ठीक है? Yes? Very very commonly asked question. Be careful. Hopefully we are expecting this question to come in the exam. Okay? Now, next what we have after we're done with mupirocin, we're going to go with what drug causes thymidine-less death. ठीक है? What exactly is that? One second. There's some issue with the question. One second. Just be online. Let me just check this 1 second. Okay. Okay. So what exactly are you looking at? Question number 22, right? Okay. Thymidine less death of cancer cells. It missed out the cancer cells. Drugs causing thymidine less death of cancer cells. What exactly is thymidine less death of cancer cells? Cancer cells क्या है? First thing, tell me that. What are cancer cells? Cancer cells are unwantedly not required growth of cells which is there. So do you think that the DNA is important in even cancer cells? Yes, of course it's important. Why? Because how does a cell know how much to grow? कैसा मालूम यार? There should be a book telling na. How do you become doctors? There's a book called as what? Tripathi. There's a book called Chaurasia. There's a book that maintains things, of course. So what does it say? It tells you what to do next, etc. So here also there's a DNA that tells. Okay? Let's see what exactly happens here. Look at this. Over here, thymidine less cells, the inability of cancer cells to synthesize thymidine, DNA synthesis does not occur, therefore the cell death. For example, if there is no thymidine, there's not going to be proper DNA. Cancer cells, they'll divide. There's no thymidine, DNA is wrong. Do they grow? No. The cells will die. Nice, no? That's how 5-fluorouracil works. 5-fluorouracil is a pyrimidine analog. It's an analog. It looks like pyrimidine. Okay? The analog comes in place of what? Thymidine, and it forms a wrong thing. That blocks the conversion of your thing to form thymidine. It blocks the conversion to form proper DNA. When the proper DNA is not made, the cell does not know what to do, and the cell does not have a proper DNA. When there's no proper DNA, the cell just goes and dies. It does not know what to do. Okay? It never knows how to survive. What about 6-MP? Mercaptopurine is a purine analog. Okay? Inhibits purine synthesis. It does not cause thymidine-less death. Now thymidine बोला ना, you have to look at pyrimidine type. Purines क्या है? Pure as gold. Remember, purines are pure or Ag, as gold. So now pure as gold मतलब क्या होता है बोलो? Pure as gold is adenine and guanine. Pyramid can be made by cutting the paper. You can make a pyramid with the paper by cutting the paper. Cut. Cytosine, uracil and thymine. Remember that. Okay. Next what we have? Methotrexate. Methotrexate है यहाँ पे. It is going to be affecting your which enzyme? DHFRase, dihydrofolate reductase. Yes. Indirect effect is there of course, but not as good as 5-fluorouracil. So this answer might be right if 5-fluorouracil would not have been in the option. Yes, it does cause DNA damage, but not to the level of what 5-fluorouracil was doing. Okay? Next is cyclophosphamide. Cyclophosphamide is an alkylating agent. Okay? It cross-links the DNA, does not cause thymidine-less death of the cancer cells. Remember that. Okay? Very, very important. Now, next. Next question क्या है? The answer was 5-fluorouracil. Next what we have, question number 23 is going to be your neostigmine, not used in. First understand what is neostigmine. Anyone tell me what is neostigmine? What is neostigmine drugs? Hai na? What are those? Stigmine drugs are going to be your Anticholinesterase inhibitors. Anticholinesterase inhibitors. How does it work, man? How does it work? And neostigmine और physostigmine में क्या difference है? Which of the following can be used in myasthenia gravis and some can be used in atropine poisoning of the brain? Why is it important? Get the concept right. Okay. The first thing that you should know is that neostigmine is a quaternary compound and physostigmine is a tertiary compound. मतलब क्या है इसका? So if you want any of these drug to cross the blood-brain barrier, you want it to have one of the valencies free. मतलब कि it should be a tertiary compound, not a quaternary. If it's a quaternary one, it will not cross the blood-brain barrier. How to remember? If for example, you're going to an exhibition, which I started in Hyderabad now, of course, you need to buy a ticket. But you went to exhibition outside, you saw that the nice, nice ice cream cart, nice this, that, papad, samosa. एक हाथ में पापड़, एक हाथ में samosa, दो हाथ में अंदर. You don't have any free valency to what? Buy a ticket. Can you enter the exhibition? No, you can't enter the exhibition because you have no free valency to hold a ticket also. But the same thing, if you have one valency free, can you hold a ticket? Like physostigmine has trivalent. Matlab he has one hand that is empty. He can go and say, give me one ticket to go inside the exhibition. Exhibition is your brain. So it can cross the blood-brain barrier. Remember that. It will cross the blood-brain barrier. So remember that. So now physostigmine is not used for, not used for. Of course it is used for myasthenia gravis because the condition is not brain related. ठीक है? Okay, myasthenia gravis में it is used. Yes or no? Yes. Next, curare poisoning. Curare. What is curare? Curare drugs क्या है bro? Any idea? It's because of tubocurarine, etc. Skeletal muscle relaxants. Relaxants, you know. What does neostigmine do? Increase the acetylcholine. So it may help you to reverse the action by increasing acetylcholine so that the contraction will happen. So you can use in curare poisoning also. In snake bite, it is neurotoxic in nature, snake bite. Of course, it will help you in neuromuscular transmission. Supportive role है, not the main treatment, but it is used. So myasthenia gravis में the main treatment है वो. Curare poisoning में also very helpful. Snake bite में common, it is used. But in OP poisoning, this also is a anticholinesterase. OP also is a anticholinesterase, permanent type, irreversible type. So do you want to cause another reversible type? देखिए क्या करोगे आप? You have to give anticholinergic. You cannot give a cholinergic drug anymore. Understood? Doesn't make sense. In the treatment of a permanent or irreversible anticholinesterase, we'll give a reversible anticholinesterase. Doesn't make sense, man. ठीक है? You give an anticholinergic. Remember, there's a difference between anticholinergic and anticholinesterase. Anticholinesterase will work on the enzyme. Anticholinesterase was the enzyme that was breaking down acetylcholine to form acetylcholine. Therefore, it will be there. Anticholinesterase मतलब क्या वो enzyme को block करता है. Therefore, acetylcholine will raise and help in contraction. Got it? If you are already having that action, why will you give it? Because already irreversible type is doing the same one that neostigmine normally does as a reversible action. You have to give something opposite. That is your anticholinergic देना पड़ेगा. Atropine is the treatment in OP poisoning, not neostigmine. Got it? Very important. So question number 23 was neostigmine is not used in bulgur. ठीक है? Next what we have, very important question, very helpful question also. ठीक है? Very easy way to remember also. The treatment was OP poisoning, yes. Next we are going to this very nice question. Carbidopa is combined with levodopa. Why? Very, very important. What is carbidopa? What is levodopa? Where do we use it? Any idea? Levodopa is going to be used as a treatment of a very important condition called as Parkinsonism. Parkinsonism सुने? हाँ, तो Parkinsonism is a condition where there's a problem with the levels of dopamine in the brain. Therefore, he has, kind of, trembling and everything and short steps and stuff and all. So the treatment in Parkinsonism is to raise the dopamine levels by giving L-Dopa. Okay. Now it's like something. For example, you came to your classroom. It's your birthday. it's your birthday, you bought a big box of chocolates, and you're in the end, you're a tall guy. So in the end, ma'am is like, send the box of chocolates. I want to eat some chocolates. Ma'am is there in the front bench. सामने में कहीं बैठे हुए हैं. You are sending a box of chocolates. Assume, give the box of chocolates through your friends. Will it? It will reach ma'am empty. The box will reach ma'am, of course, but empty in nature. Because everyone loves chocolates, everyone will finish it. So मैम को खाली डब्बा मिलता है, मैम रख लो आप उसके अंदर. You can put sewing materials, you can put any other things, you can put stuff like khara, but not actual chocolate that came with it. ठीक है? It's like that box of that क्या है Ferrero Rocher, which will never survive. So what can you do? What can you do? Either buy a box of chocolate that has a lock, and the lock has a code that no one knows, only ma'am knows. Understood? So you'll give that locked box of chocolate. They'll see. They'll try to break it. अरे यार नहीं खोल सक रहा हूँ यार. I can't open this box of chocolates. What can we do? I cannot open this box of chocolates. What can I do? Pass it, pass it, pass it, pass it. It will reach, ma'am. Full. Nothing is utilized. Now let us bring that story into consideration here. If you are combining carbidopa with levodopa, carbidopa is that lock. Carbidopa is that lock that is present on the what? The lock that is present on the chocolate box. It does not allow peripheral decarboxylation. Look at that. Increases half-life? Not really. Inhibits excretion? No. Inhibits peripheral decarboxylase. मतलब peripheral utilization नहीं होना. It has to reach the brain, man. Bichara, this guy has Parkinsonism. He needs that dopamine level to reach his brain because it helps his treatment. So therefore, you give a combination of carbidopa with levodopa just because carbidopa prevents the peripheral decarboxylation or utilization of levodopa. Understood? Very common. And inhibits central metabolism. No, central metabolism बात ही ना हो रही यहाँ पे. Peripherally, एक बार central में आ गया, brain में आ गया, that levodopa will become dopamine only. It will show effect. Got my point? Yeah. So that is your answer. Very, very important. Peripheral protection from utilization because everyone loves levodopa. Dopamine mila to they will use it. They'll feel happy. So anywhere it can be used. So be very careful. Next question. Question number 25. So answer was what? Inhibit peripheral decarboxylation. Next question is what? Tell me. Question is safe drug for UTI in pregnancy. Very important. Pregnancy में कोई भी drug लेने से पहले you have to think 10 times. Why? The drug can reach. The drug can reach the baby. It can cause damage to the baby. Yes. So you have to be very careful. So which drug is safest? Let us see. We need a drug that does not cause too much damage. Let us see what can cause what damage. Ciprofloxacin is there, no? Ciprofloxacin is what? It's a fluoroquinolone. And fluoroquinolones have been done research under that have shown damage to the cartilages in the feces of a fetus. The fetus में cartilage damage मतलब is going to be lots of problems. Many cartilages, babies don't have big bones yet. You don't want cartilage damage in fetus. So, do you try to give ciprofloxacin? Avoid, avoid, avoid. ठीक है? It's also called tendon damage also. Next क्या है उसके बाद? Gentamicin. Oh my God, gentamicin. Don't even think. Don't look towards gentamicin also. Why? What is gentamicin? Aminoglycoside, gentamicin, cesomycin, streptomycin, tobramycin, amikacin, netilmycin, kanamycin. Easy way. GSS tank. GSS tank. Very simple. I'll just write it down so that you guys can remember. See, this has a code GSS tank. Gentamicin, cesomycin, streptomycin, tobramycin, amikacin, netilmycin. Do not write neomycin. No, 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 no. Neomycin नहीं है ये. ठीक है? Remember. Next क्या है? Kanamycin. तो mycin नहीं लिखा मैं. Now, what is ciprofloxacin? Ciprofloxacin, fluoroquinolone. Fluoroquinolone. Which type? Is it the first generation or second generation? First generation has what? NCOP, and second generation is 77 grams. Any idea? Northern मतलब North India COP finds 77 grams of what? कोकेन बोल के याद रखो, ठीक है. फ्लोरोक्विनोलोन्स मतलब क्या है ये? नॉरफ्लोक्सासिन, सिप्रोफ्लोक्सासिन, ओफ्लोक्सासिन, पीफ्लोक्सासिन. दिस फर्स्ट जनरेशन 4 ड्रग्स. यहाँ पे 77 लुक्स लाइक एल एल, नो उल्टा है, 77 लिखने का एल एल है ये. लोमी सॉरी लीवोफ्लोक्सासिन, लोमीफ्लोक्सासिन, गैटीफ्लोक्सासिन, मॉक्सीफ्लोक्सासिन एंड स्पारफ्लोक्सासिन. ठीक है, सेकंड जनरेशन है वो. ओके, विल सी दैट. नेक्स्ट क्या है? कोट्राइमॉक्साजोल. नाउ व्हाट इज कोट्राइमॉक्साजोल? एनीवन? कॉट्रीमॉक्साजोल बोलते हैं थोड़े. Cotrimoxazole means combination of trimethoprim and sulfamethoxazole. It's a combination drug. Combination of trimethoprim and sulfamethoxazole. It works on a sequential blockade. Damage तो है. Amoxicillin. Amoxicillin. Yes, amoxicillin very very important. It is the safest. It is what? It's a beta lactam drug. It is a beta lactam safe drug. So out of these of all four, amoxicillin is the best answer. ठीक है, remember that. safe penicillin, safe cephalosporins, not fluoroquinolones. हाँ, दिमाग में क्या है? ciprofloxacin, cephalosporins है शायद बोल के टिक मारते. Trap, looks like that, but it's not. So avoid fluoroquinolones, avoid aminoglycoside, because aminoglycoside will lead to full on ototoxicity and nephrotoxicity. Oto means hearing loss in the fetus, and kidneys also tata bye bye. Cotrimoxazole, it affects the folic acid. Therefore, neural tube defects, the DNA is affected, causes problem in the pregnancy. Okay, so avoid ciprofloxacin, that fluoroquinolones, avoid gentamicin, and also avoid cotrimoxazole. Understood? Yeah. So that was your 25th question. Next, what we have now, very important question, very nice question also. Let's look at the drugs. Antihypertensive that causes cough, mention cough, right? Brassy cough. ऐसे टाइप का कॉफ रहता. ठीक है. So any idea, any one of you? Brassy cough मतलब क्या है? That very that rough kind of voice. ठीक है. Right. So what we have here? Lisinopril, minoxidil, propranolol, amlodipine. Let us look what are the drugs are first. Lisinopril, prill drugs. Prill क्या है? Any idea where these prills are heard? Minoxidil, lisinopril दोनों भाई नहीं है. ठीक है. Lisinopril, then imidapril, benazepril, enalapril. So there's a nice code for these drugs. What drugs are these? There's certain type of drugs. There's going to be prill type of drugs. So there's something called as ACE inhibitors. ACE inhibitors, which is going to be very nice, easy, way of remembering, called as CRIBE. CRIBE. ठीक है. What is that? अभी दिया हुआ तो है यहाँ पर. The drug is lisinopril. You can remember that, but it's a captopril, ramipril. So or are prill only, okay? Imidapril, benazepril, enalapril, or lisinopril. So all are going to have prill. Okay. Now prill मतलब क्या हो रहा है यहाँ पे? This actually shows effect. ठीक है. This actually shows effect and causes cough. Why exactly? Why exactly does it cause cough? Any idea? Look at this. This actually has an effect on something called as what? Bradykinin. Have you ever heard the name bradykinin? ठीक है. Why ACE inhibitors cause cough? बहुत याद रख लो. ACE inhibitors, of course, they are angiotensin converting enzyme inhibitors. Angiotensin converting enzyme inhibitors मतलब ACE inhibitors will not allow the conversion of angiotensin nogen to angiotensin. So that conversion does not happen. When does not happen, what happens? It will also break down bradykinin substance P. ब्रैडिकाइनिन जब रेज हो जाता, अगर एस इनहिबिशन हो गया तो, because ACE was responsible for bradykinin breakdown. But once ACE inhibitors are inhibited, ACE inhibitors cause inhibition of angiotensin converting enzyme. Bradykinin will raise, no? It also had to get broken down. It did not. So bradykinin, when it raises, it leads to something called a dry cough. Understood? So people taking pill kind of drugs is going to be are going to be causing cough, brassy cough. Okay? Remember that. So in these drugs, which of the following drugs actually is a ACE inhibitor? Lisinopril. What is minoxidil? मिनॉक्सिडिल क्या है? हेयर ग्रोथ के वास्ते यूज करते हैं मिनॉक्सिडिल सॉल्यूशन. ठीक है, हिरसुटिज्म, इट कैन बी कॉजिंग हेयर ग्रोथ एवरीवेयर, कॉफ नहीं होता उससे. प्रोप्रानोलॉल क्या है? इट्स अ बीटा ब्लॉकर. ठीक है, इट डज नॉट कॉज दिस. इट कैन कॉज ब्रोंको कंस्ट्रिक्शन, नॉट टू बी गिवन एस्थमा पेशेंट, यस, बट कॉफ नहीं करता वो. प्रॉब्लम होगा बट कॉफ नहीं होगा उससे. ठीक है, एम्लोडिपिन क्या है बोलो? एम्लोडिपिन इज अ कैल्शियम चैनल इनहिबिटर. ठीक है, calcium channel inhibitor, it will cause edema and flushing but not cough. Remember that. So cough or brassy cough is a part of what? Your pill types of drugs. So ACE inhibitors. Okay, ACE inhibitors, very very important. Okay, that is your answer over here. Next, see, answer is lisinopril. Next, what we have is going to be your question number 27. That is going to be your what? Drug reducing uric acid. Uric acid by what? Uric acid क्या है यार? यूरिक एसिड जब बढ़ जाता है हाइपरयूरिसीमिया, व्हाट डज इट कॉज? गाउट. ना व्हाट, हाउ कैन यू डू दैट? यूरिक एसिड रिडक्शन, पहले आप यूरिक एसिड साइकिल देखो. साइकिल देख ले, समझ में आया था आपको. यूरिक एसिड is going to be by breaking down of a thing. What is that? First you have your hypoxanthine, xanthine. This breakdown of your purines to form what? Tell me. एडनिन, ग्वानिन है, हाइपोxanthine है, तीनों प्यूरिन्स है. They all will break down to give you uric acid. Too much of uric acid causes hyperuricemia. That uric acid will cause problem with the kidney, causing uric acid stones, will cause deposition in your what? Knees and joints and all, causing uric acid arthritis. All of these problems will happen. ठीक है? So now how can we do? For example, याद रख लो यहाँ पे यूरिक एसिड आप कम करना है. यूरिक एसिड के साइकिल में क्या देखिए आप लोग? There is a cycle in which we start with adenine or guanine or hypoxanthine formation will happen. That will convert into xanthine. That will convert into hypoxanthine uric acid. Enzyme is what? Xanthine oxidase. Xanthine oxidase. ठीक है? Block this enzyme. खत्म. They are not formed. Therefore, no uric acid. ठीक है? Simple. The conversion of hypoxanthine to xanthine to uric acid. Remember, hypoxanthine to xanthine to uric acid. What is the enzyme here? Xanthine oxidase. Simple. Enzyme रोक दो. You can't convert hypoxanthine to xanthine only and xanthine to uric acid. No formation of uric acid only. When there's no uric acid only, will you have problems? No. Therefore, reduces. In gout, you can reduce uric acid by giving drugs that cause xanthine oxidase inhibition. What is HGPRT inhibition? Hypoxanthine, guanine, what? Phosphoribosal transfer inhibition. That's not the condition here. What is that condition used for? Remember, it's Lesch-Nyhan syndrome. What is it? Lesch-Nyhan syndrome. ठीक है? Remember that. Next क्या है? Thymidylate synthase inhibition है. वो 5-fluorouracil का extract है ये. We don't have that effect. In any no involvement of this cancer drugs के वास्ते है, not for uric acid. PRPP inhibition क्या है ये? This is not used on phosphoribosyl. What is it? Phosphoribosyl transferase. ठीक है? Remember that. So it's not used in gout. Gout में तो use नहीं होता. ठीक है? Phosphoribosyl pyrophosphate का है वो. Remember that. So इसमें majorly is going to be your formation of what? Your drugs over here. Now if you give a drug called as allopurinol, it will go and block xanthine oxidase or febuxostat. So here drugs is xanthine oxidase inhibition is done by drugs like allopurinol or febuxostat. Okay, remember the drugs, very very important. Okay, now next what we have after 27, we are going to go to question number 28. ठीक है, become 6:30 almost, become very long class. I'll complete till question number 30 and then I'll give you another video of the remaining 10 questions. Okay, yeah, so let's go to the next one, that is anti-diabetic drug not requiring dose reduction in renal failure. See, the action is antioxidant inhibition. Now, what is the next one? Anti-diabetic drug that does not require dose reduction in renal failure. Matlab the drug should not be causing damage to the kidney. What are those drugs? Let's look at this. Many drugs actually are renally excreted. Okay, the dose reduction is required, of course, because if your kidney is not working, renal failure hua, so you have to reduce the dosage because it's not leaving the body. No? Kidney will remove the drug. If kidney can't remove the drug, where will the drug go? It will stay in the body. So of course you can't give a high dose because it will stay in the body and cause more and more diabetic, anti-diabetic action. Be careful. You have to reduce the dose. Yes. But linagliptin is a DPP4 inhibitor. Unlike others, it is not excreted by your kidney. It's like hepatobiliary excretion. Hepatobiliary excretion. So that what happens? Renal clearance is minimal. Mainly hepatobiliary excretion is there. So adjustment is not required. Sitagliptin, of course, you require renal excretion is there. Vildagliptin, completely renally cleared only. Saxagliptin, all of these are renally cleared only. All in CKD condition, renal failure conditions, you have to change the dose because if the kidney is not working, it will stay in a for a longer period of time, causing more and more damage. Be very careful. Okay, right? That is your question about antidiabetic, which is not require dose reduction in renal failure. Okay, be careful with the answer. Answer is linagliptin because hepatobiliary clearance is there, not what renal clearance. Right. Drugs following zero order kinetics. Zero order kinetics का मतलब क्या? You know what is first order kinetics and zero order kinetics? First order kinetics क्या था बोलो? Remember, rate of drug elimination is directly proportional to the drug concentration. Zero order क्या है? Concentration का कुछ भी नहीं होता. Fixed amount is removed per unit time. Fixed amount कुछ भी हो. Concentration high रहने दो कुछ भी रहने दो. Remove 10, remove 10, remove 10, remove 10 is what? Zero order. First order is 100 है 50 निकालो, 50 है 25 निकालो, 25 है 12.5 निकालो. That is first order. Okay. Which of the following of them have zero order kinetics? Zero order kinetics कौन सा है इसमें से? The first one phenytoin, second one clopidogrel, morphine or propranolol. Now phenytoin actually is the answer over here. ठीक है. Examples you have to remember PEA, phenytoin, ethanol and aspirin. PEA. Very important. High dose aspirin, ethanol and phenytoin. All of these are answer for your zero order kinetic drugs. 0 watt पर warfarin भी आता है उसमें. ठीक है. So these are your examples. वहाँ पे clopidogrel, morphine and propranolol are not there. These all remaining three follow first order kinetics. Means it goes remover of percentage depending upon how much dosage is there. But whereas phenytoin equal amount every time 10 10 10 10 बोल के निकलता. Remember. So zero order kinetic example is what? Phenytoin in this order. Okay. In this group of drugs, phenytoin is the answer. Next, what we have? ATT, drug causing optic neuritis. What is ATT? What is ATT? Any idea? ATT is anti-tubercular treatment. Simple. Anti-tubercular treatment. It can cause optic neuritis. What are the things? Let's see the drugs first. INH. What is INH? Isoniazide. Uska action is not optic neuritis. It does different things. What are that? INH is important because it causes something called as peripheral neuropathy. What is it? Peripheral neuropathy. Why? Because remember it causes pyridoxine reduction or deficiency. Pyridoxine is very very important for the nerves. Therefore peripheral neuropathy. Pyridoxine क्या है? B6. That's why whenever you are giving isoniazide, you will always give a B6 supplementation. Remember that basic supplementation is very important. Next क्या है उसके बाद? Rifampicin. Rifampicin में क्या होता है बोलो? Rifampicin of course orange colored urine was it's not an adverse effect, it's a side effect. ठीक है? Rifampicin will cause hepatotoxicity, orange discoloration of the fluids, but not what? Optic neuritis. नेक्स्ट क्या है? पायरिजोनामाइड. पायरिजोनामाइड का क्या है एक्शन? हाइपर यूरिसीमिया होता, हेपेटोटॉक्सिसिटी होता, बट नॉट ऑप्टिक न्यूराइटिस. द एक्शन इज बाय इथैम्ब्यूटॉल. ठीक है? नॉट दिस, नॉट दिस, नॉट दिस. आंसर इज इथैम्ब्यूटॉल. रिमेंबर इथैम्ब्यूटॉल. ई फॉर आई, ई फॉर ऑप्टिक न्यूराइटिस. याद रख लो. ई फॉर आई प्रॉब्लम, E for ethambutol, E for I has optic, right? So optic neuritis, remember that. Very important. Okay, so that is your 30th question, answering that. Next question, let's do another question of choice for Alzheimer's disease. Alzheimer's disease. इसमें atropine है, donepezil है, physostigmine है, fluoxetine है. What are these drugs first? Alzheimer's में he is forgetting stuff. ठीक है? There are special drugs that are mentioned in your book for this particularly. ठीक है? I'll not mention that one drug, I'll mention other drugs that are over there along with it. ठीक है? One is there over here, XYZ में से. Other is tacrin. ठीक है? Other drugs that we have is what? Rivastigmine, galantamine, and XYZ. Which drug? Now, atropine. No. Atropine is what? It's a anticholinergic drug. We don't use it over here. ठीक है? Remember that. Second is fluoxetine is SSRI, not used in Alzheimer's disease. Physostigmine used in what? Atropine poisoning of the brain. ठीक है? Blood brain barrier, it will cross the BBB, goes to the brain, helpful. Rivastigmine, not physostigmine, rivastigmine and galantamine. ठीक है? Okay, so Alzheimer's के ये चार ड्रग है, टैक्रिन, डोनापेजिल, राइवास्टिग्मिन एंड गैलेंटामिन. ओके, रिमेंबर दीज ड्रग्स. टैक्रिन में है, नॉट यूज गैलेंटामिन. ओके, रिमेंबर दीज ड्रग्स. टैक्रिन में है, नॉट यूज दिस इज वेरी डैमेजिंग ड्रग, बट अगर पूछे तो यू शुड नो. यस, गैलेंटामिन भी था, राइवास्टिग्मिन भी था, डोनापेजिल भी था, टैक्रिन भी था. ओके, राइट. चलो, I will end today's class because it has become already 6:30. It had to be a 1 hour, 1.5 hour class. It became almost 2 hours class. ठीक है? I'll be having a biochemistry class. I'll give the remaining audio and video also later on. ठीक है? Anyone, if required, just tell me. Do you want me to continue till question number 40? If I get a yes, I'll continue. I want a comment that says yes, sir. Please continue and complete it off. I'll do it off. I'm not seeing any reaction from anyone in the chat. I don't understand. Tell me. Yes, sir. Please complete. I'll do it off. Waiting for the answer. Okay, see you guys. All the best for your exam. I'll send you the remaining questions as well. You can have a revision of that. Important questions. Okay, you can go through them and let me know. Okay, right. Bye. Take care. Sayonara.